my mom was, it goes back to the fall of 98. She started experiencing chest pain, fatigue, shortness of breath. Cardiologists here had determined that after an angiogram, she needed triple bypass surgery. I innocently thought that the surgery was going to take place here at our hospital, and to my surprise, no, triple bypass surgery was not happening here. She had to be flown to London, Ontario. That was pretty tough.
About a year ago, I was walking and I got these shooting pains up my back that dropped me right to my knees. Through some visits to my family doctor and to some other specialists, they decided that I should have an angiogram, which I did. So I had my angiogram with Dr. Negro, and he informed me that I need to have a bypass surgery, and I was going to be sent to Hamilton because I could not do the operation in Thunder Bay. I was shocked I couldn't have the surgery here. I had no idea I would have to go out of town. I was scared I was going to die. I didn't know if I was going to make it. So now I've got to travel, put more anxiety on myself and on my family to figure out what's going to happen with me. I shouldn't have had to travel for this life-saving care.
Northwestern Ontario is a region where a large percentage of the population faces serious medical issues. Compared to the rest of Ontario, we have the highest rates of cardiac disease, cardiac mortality, kidney disease, amputations, diabetes, and hypertension.
Cardiovascular disease is still the #1 killer in Northwestern Ontario. Did you know we're more likely to die of cardiovascular disease here than any place else in Ontario? And we're more likely to have limbs amputated because people in Northwestern Ontario aren't being treated.
Our physicians, like Dr. Andrea McDougall, see the need for life and limb-saving surgery every day.
So some of the patients that we see are critically ill, and without surgery, within a few hours, they can die. We do have cases where you always wonder if that patient had been able to have surgery locally rather than waiting to be flown out, would their outcome have been different? So it does get to you.
Thunder Bay is the only city in Ontario where cardiac and vascular surgery can be a lifetime away for some patients. We live in a region where we're at the highest risk to die from cardiovascular disease, but we don't have the services to save our own lives. Let's face it, we're 1,500 kilometers away from the nearest center that could provide these services. No one in Ontario lacks this critical access. No one. It's our time to bring life and limb-saving cardiac and vascular surgery to Northwestern Ontario.
Recognizing that cardiovascular surgery is critical to the health and well-being of residents of Northwestern Ontario, we've partnered with a global leader in cardiovascular care, the Peter Munk Cardiac Centre at the University Health Network, to bring the highest quality cardiac and vascular surgery here to Thunder Bay. Quality, safety, and local access will be the cornerstones of this partnership. Once in place, our surgical program will improve access to urgent and emergent cardiac and vascular surgery, enhance our regional trauma care, improve the vascular access required for the high volume of patients needing dialysis, and decrease the use of amputations as the first line of treatment for vascular disease.
This program will drastically impact the lives of patients and families in Northwestern Ontario. Not only that, but through this program, we'll need to bring in 64 full-time, highly skilled health professionals. This partnership with the University Health Network will open up new opportunities for clinical trials and research projects.
Along with improved patient care, our partnership with the University Health Network will provide additional opportunities for research and academics, further strengthening our ability to care for patients and families closer to home.
I'm very confident that we'll be able to offer our patients the same quality of care as they would get in Southern Ontario.
To know that this is in your own backyard, I think is very comforting. You don't have to go away for this. You can recover at home. What if there are maybe some complications and you need to go back to the hospital? If you've had the surgery out of town, where do you go from there? But to have that type of surgery here and to know that it's right in my own backyard, I feel more comforted and more at ease.
Once in place, we'll be able to provide full-service cardiac and vascular surgery to 1,000 patients a year, saving both lives and limbs.
These surgical services will be a tremendous advantage to patients and families. No more long-distance travel outside of Northwestern Ontario, no added stress, no worry about how to afford the trip, no wondering about whether you'll make it in time. Best of all, your entire family can be together before, during, and after surgery. What price can you put on that? We need this care, and we need it now. Your support is vital in making this a reality. Please join me in making your gift. Let's take care of our hearts at home.